Good afternoon, students. Let us start the instrument class again. So, on our last class, we have discussed the parts, dissecting parts of instruments, sponge forceps, foot forceps, dissecting forceps, hemostatic forceps, purchase hemostatic forceps, needle holder. So today we will start with the towel clamp. Towel clamp. This is a towel clamp or towel clip. That keeps a bit of pinch. Okay. In any kind of surgeries, we have to, before start the surgery, we have to wrap the area of the operation. Okay. Whatever the operation is, maybe it is the abdominal, maybe it is a minor surgical cases, various superficial swellings of like sebaceous, lipoma. It may be anything. It may be for circumcision, anything. We have to cover the area of operation from the other area. We have to clean the area. We have to cover the area from the other so that there will be less contamination. This thing. This towel clamp, there are two types. That was another one is pinching like actually is there. So two types of towel clamps. These two types. That was so it helps to hold the towels in place, to hold the drap sheets in places, so that the area required for the operation will only be exposed and the other areas will be less, so there will be less chances of contamination. This thing helps in maintaining those sheets, drap sheets in place. One thing. Second thing, it can be used in other functions. This is the main function of this towel. It can be used. You have seen the OTs when we perform the laparoscopic procedures. So, in those laparoscopic procedures, there are many wires. We have to move many wires from one side to the other side of the patient, like the suction tube, like the tube, like your camera source, those things, and diaphragmatic cables, those things. We can clamp those. We cannot clamp actually. We can fix those things with the towels so that those wires doesn't come in front of the operative field, so the operation does not get hampered. Before securing those wires, you have to make sure that you are not pinching. This is a sharp tip. Okay, these tips have the sharp pinching like action, so you should not pinch those instruments. You pinch those wires with this tip, or else it will get hampered. Suppose a diaphragmatic cable, you pinch this with this tool, so it will get hampered. Its functioning will be difficult, and there may be leakage, spreading of the time as well. Okay, if you pinch our light source cable, our camera cable, then it will also hamper the vision of the laparoscopic. Not only just laparoscopic operation, also. Do any one of you have any query? In open operations also, means exploratory laparotomy, any kind of normal surgical procedures, we used to use these towel clamps to fix those wires with the drap sheets. Okay. One more function we can do we can use these things as a tongue retractor. Okay. During various ENT procedures, you can hold the tongue with this and pull it. Sometimes in the hernia operation also, sometimes it is not made for this specific thing, but sometimes in the hernia operation we can use this as a cord clamp. Okay. So sterilization, we have already discussed. These are all metallic things. We use the autoclave. Can we move to the next instrument? It's the same thing. Towel clamp. Allow exposure of the operative cell. Okay. Allis tissue forceps. This is very common and very important instrument in almost all surgical procedures. This thing you can see that the blades we have discussed previously also. This is the blade, and the tip of the blade it has the tooth-like structures. Okay, and this is the box joint. This is the handle. This is shaft, and this is the finger. Okay, this is the direction. So this is a lighter instrument. This is a lighter instrument. Lighter instrument. What is the use? See, if we want to give someone this pen, okay, you will hold it like this, two fingers, right? Like pinching action, you will hold this. If you hold this like this, see, we are compressing the whole thing, compressing the whole thing in all of its length. This is the action how we use the artery forceps, the whole length. And this is the action how we hold the thing, a tissue forceps, these things, or you can say that dissecting forceps, good dissecting forceps. This is how we hold this. So there is a gap. So only the desired action size we hold it, and we can use those things. For this, whenever we get these two blades approximated, means we apply those ratchets, there will be a gap. Always these two blades, there will be a gap, except the tip. The tips will oppose each other, but there will be a gap. Why this gap is got? So that we can just hold the tissue and retract. We can retain space for this use, retract the tissue, but we should not crush the area. If the two blades would oppose each other completely, then the tissue which will become in between will get crushed, like hemostatic forceps. Okay, so this is the difference between the two things. This only hold the tissue with these tips of the blade, and there is a gap between the two blades so that the other tissues can be accumulated inside. Okay, and the hemostatic forceps, what was the difference there? It doesn't have any gap. See, does it have any gap? No. It opposes completely. So it doesn't have. This is the Kocher's hemostatic forceps also opposes completely. Though it has tips in the tip, Kocher's hemostatic. Remember we discussed it on the last class. This doesn't. It has a tip in front, but it opposes so that the tissues come in between get crushed. Here, there will be in tissue forceps, there will be a gap, so the tissues in between will not get crushed. So where can we use this? We can use this instrument in any kind of open operations also, like while retracting the skin, we can hold the skin with this and retract it from the so that we can expose the, like suppose we are talking about the exposure laboratory midline incision. After giving the skin incision with the knife, we will hold the two ends of the skin incision size and retract it so that our linear alba get exposed. Okay. Then we give incisions of our linear alba, we will hold the linear alba, retract it so that we can go inside the peritoneal cavity, we can expose the peritoneum inside and then go inside the peritoneum. Okay. Like this, this can be used to hold, simply hold the any tough structures inside any tissue, like any. These are also have various size, smaller and larger. So that larger instrument will be used in the deeper to hold in the deeper structure, so that we can reach up to the structure. And the smaller one we will use in the superficial operations, like suppose we are going for a superficial excision, ganglion removal, like this. Smaller one. So any kind of tissue you can hold. But remember one thing, this have is in front, so it is little bit traumatic. It can be cause damage to the tissues, so use it firmly. Though it is not a heavy instrument, so the damage is very minimal, So sometimes you can use it on the intestines also, but this will be very cautious. We have to use it very cautiously. Okay. That cause tissue only puts. Whenever this instrument will come to in front of you, one question will come. You are going to ask everything on the appendix first. This is mostly used during the appendicectomy operation. Though you can use it in the other operations as well. And this function is not similar, but has some similarity with the tissue forceps. See the parts. This tips, the tissue forceps, what is the difference? This tip has the tooth. This tip has the groove. There is one, this blade will go, there is a groove, it will attach to this groove so that it can hold the tissue. Here is a penetration at the tip point. Why this is given? So that the tissues come here can get expanded. That does not get crushed. Okay, see, this is a carved part. There sufficiently amount of tissue can get accumulated without any damage. There is a penetration, so the extra benefit has been given, so that it can be expanded between these two windows. And there is a groove for the fixation. It also has the lattice, so that it holds. Mostly, this is used in appendicectomy, open appendicectomy. Sometimes you will be upset that how many Babcocks is required in an open appendicectomy. So, minimum we need 2 Babcocks in an open appendicectomy, but generally we need 3 instruments. Okay, 3 Babcock forceps. Why? With one Babcock, we will hold the tip of the appendix. With one Babcock, we will hold the body, and with the other Babcock, we will hold the base of the appendix. So that the complete mesoappendix part will get exposed, and we can make the window over the mesoappendix and tie the appendicular artery. Okay. So, see, this is when we hold the appendix with this. Appendix will be in this gap, so that it doesn't get crushed, it doesn't get washed up. This can be also be used. Even Allis forceps also can be used during various other operations like your gastrojejunostomy, means any kind of anastomosis to hold our anastomotic parts before anastomosis. Like how we do, we first hold the 2 parts of the bowel which we are going to cut and open with the tissue or the backbone. Any one we can use, and then in between these two we make our incisions and then hold the edges and start the anastomosis treatment. Okay, so we can use any one of them. Mostly we use the Allis, and the larger parts like when we do anastomosis with the stomach and those things, we generally use the Babcock. Even Allis also we use. Most commonly used instrument is the Allis. Babcock generally mostly used in the appendicectomy, and sometimes various kind of anastomosis. You have to know about what if you go for the anastomosis in the operating section, we'll be knowing what may be the various kinds of anastomosis, like with what, it depends on what to what, like if stomach, with the stomach to the bowel means jejunum, then next to jejunostomy, if duodenum with the, so you have to select which part you want to go with which instrument. See, both these have the tooth in front, which have the groove in the front. This is the non-traumatic part, very less here, and this is also have some traumatic, very less traumatizing effect. But so generally, like suppose we are discussing the duodenostomy, then ideally we hold the duodenum part with this kind of instrument, not the seat people will use the very lighter part of the instrument. Okay, so we have to use our instrument cautiously. For that, we have to know our instrument. So for this only, this class is very important. Okay. Lens tissue holding forceps. See the difference between the two parts. This is the blade. The whole, almost the whole blade is curved. Okay. See here, the proximal part is straight. The distal part only curved. Here, the proximal part is little bit straight and just tip is curved. Okay. Here's Allis, Babcock, leg. Legs have penetration at almost the whole blade. Babcock have penetration only the curved tip part. Okay. And Allis doesn't have such penetration. Okay. This is much stout, much heavier instrument than the Allis in the Babcock. So, where can we use these things? This is for holding the much tougher tissues, fascias, and generally we use this in the any kind of operations involving the stomach part. And as this is a larger instrument, so and the gap is much more, so we can use it as a port necklace. Scalpel holder, also known as a Parker handle. Okay, this is the first instrument for any operation, because without giving incisions, so nowadays various nose surgeries are there where we do not use the knife and the handle, but most of the operations we need to first start with giving incision, and to give an incision we need a proper handle to handle the knife part. So this is a scalpel holder, or it is also known as a Parker handle. It is various types depending upon the which kind of knife we are going to use. Okay, the knife has various purpose. Knife has various types depending upon the knife. There are various types depending upon the what operation we are going to do. Suppose we are going for a exploratory laboratory. Can we? Suppose we are going for an exploratory laboratory. So this is a bigger incision, stout incision we need to give. So we'll use the bigger size knives like 22, 24, minimum 20, 20. Suppose and we are operating for sebaceous cyst or your lipoma and it's a small lipoma. So we'll use the smaller size of the blades. Can you see this picture? Thank you very much. Thank you, Rakudeep, for helping me. Where can I find this? Yes. See, the various blades are there. Most commonly, we are using the number 10. You can type your message if you want to. Okay. I'm continuing. So these are some stouter, larger blades we often use for the larger incisions. And these are the smaller blades, 10, 11, 12, 15. These are smaller blades we use during the small incisions. It's a blade. See the difference. It's tipped. Mainly the 11 and the 12. Its tips are pointed. So where can we use this pointed tip? Mostly incision and braiding procedures. Okay, where we just inside, just make a stab incision. Then at their side we can use the 11 and 12. Some other places also generally we use this kind of place, like in appendicectomy, open operations, appendicectomy, when after ligating the base, we want to remove the specimen, and also after ligating the vessels, we want to cut the vessel cut also. That time we can use this blade. Appendicectomy stump generally we cut with the 11 number. Okay. Again, we want to after the operations we have something. Suppose there was an abscess. We want to drain the area and take the drain out through a separate incision. Suppose there was suspicion of any leakage after the operation, or any suspicion of hemorrhage post-operatively. So we'll keep drains for this. To take out the drain, we use generally 11 number blade, so that it goes in step back, and then one incision with this side we can increase the incision. Okay. These blades we are using. While operations like exploratory nephrectomy or our open cholecystectomy, right subposterior incision, like this larger incision will give you this bigger. Now coming to the Babcock handle. Babcock knife, scalpel holder or handle. So this is also various size. We have seen the smaller size, larger size blades. Now we cannot hold those blades with our hand. It is risky. We can injure our hand fingers also. So we will use it as a handle, so that there will be sharp control while using the blade. Okay. Control is very important. So this thing also, there are generally 4 numbers. This one, the larger one, will be using the handle number 4. Okay. The smaller ones will be 3, 5, and 7 number of handles we are using, but the larger one. So it's depends this one, this handle, tip of the handle, where the blades get attached. Depending upon this tip, the various numbering of the handle has been given. So it is used to hold the blade at this tip part, and any kind of operation we have to do. Okay. Scissor. Scissors are made to cut and dissect. So you can see this scissor. It has one sharp, one end blunt. Okay. See this scissor. This is one end. Both the ends are sharp. Okay. This is the curved one. Curved scissor. It is not so clear, but it is also a curved scissor. See this one. Both the ends are blunt. Okay. So what are those things? Let's go to the first one. Whenever we want to, scissors are made of various types, various scissors are there. Some scissors we use just to cut after giving the knots, we have to cut the suture. Right? So for this mainly, we are using the blunt one. Both the ends are blunt. This mostly we are using for those blunt dissection purpose. Okay. Suture means suture cutting suture, you can say. Yes, suture, it has been written. And the sharp tip scissors, during any kind of tissue dissection, anything, you need to insert this sharp part first, then cut. So the sharp end scissors we are using to dissecting the fascia, muscles, those one blunt and one sharp. Okay. Let us go with the part. This is the blades, 2 blades. Obviously, this is the sharp blades. This is the joint type, unstable joint type. This is the 2. And see, there is no ratchet. Scissor has no ratchets. Okay, and the finger. This is also used to cut and dissect the tissues. Both the ends are your pointers. This This is the straight scissor. Now the curved scissor. Suppose you are going to cut after ligating the cystic duct and the cystic arteries. You are now supposed to going to cut the in between the two ligatures. You are going to cut separate the vessels and the ear part. Now, if we use the straight scissor, so my vision will, if I see these things, that part structure in front will be hampered. But if we cut like this, curved scissor, we use the curved scissor, then my vision is going to this area, so I can see and cut. So it is easier to use the curved scissors in the deeper part to see and cut. But in the straight part, it will be difficult, as the thick part it is difficult. The scissor himself is blocking my vision. So the straight scissors are mostly we are using for the superficial, cutting the superficial tissues, and the curved scissors we are using mostly deeper part to cut anything deep. Yeah. This is the main difference, and also controlling is also better. We have discussed about the suture cutting scissor, Mayo dissecting scissor. This is the straight one with the lighter version, and the Metzenbaum scissor bottom. There is a difference is in the box. Joint pattern is different, and joint pattern is different. And this is saying that Metzenbaum type, the blades are little bit smaller compared to the body. Okay. Sorry, start. Bandage scissor. See, when we after anything mostly used in the orthopedic department, surgical department also we are using sometimes. Sometimes we need to apply the springs, we need to apply the cast. So during those bandages, we remove those bandages and dressing. This scissor, Mr. Bandage scissor. This is different, very different from the previous which we have discussed. It has two blades, but both the blades in full length they are curved. Okay, angle there. At the tip of one blade there is a blunt flattening part. This part we have to insert the bandage part so that it doesn't injure the skin or cause any damage to the normal tissue. Then this will be kept outside, so we will cut the bandage. Mr. Bandage scissor. Through it is blunt, inserted under bandages with relative safety. Okay. So long we have discussed today. We have discussed those instruments which are very common in almost all the operation trolleys. I'm also getting out of time, so we'll go through a quick review of the class we have discussed so far. The towel clip we are used mostly to hold the straps on the area, so that the operation field will be absolutely placed in places, and the operation field will be separated from the other skin areas to remove the contamination. It can also be used as a tongue clip, it can also be used as a cord holder, and to hold the wires also doing any kind of open operations also laparoscopy. But you have to take care of while applying this so that the tips does not cause damage to the wires. Okay. Tissue forceps, most commonly used instrument in all the trolleys, operating trolleys. It is used to retract the skins, retract any kind of tough tissues. Okay, that for tissue holding forceps is also a common instrument. This is like actually it's like the tissue forceps, but this is the most important function is in the mechanism to the operation. Lens tissue holding forceps, this is not so commonly used, but mostly used in the gastric surgical operations and some holding some tougher structures. blades. All trolleys, all operating trolleys, you will see those surgical blades. These are of various numbers. The 10, 11, 12, 15, 18, these are the smaller size, and the 20, 21, 22, 23, 24, this is the larger size. Mostly we are using the operation, smaller operation like superficial small incision. We are using the smaller ones like 10 and the 15, and the larger like cholecystectomy operation or midline operations. We are doing the incisions with 22, 24 sizes knives. And for incision and drainage, means for stab incision, we are using the 11 and 12. How to give incision? We need stability. For this, we need the holder of those blades. So for this, we have the Babcock handle. So this handle is also of size. The number 4 is for holding the larger size, and the other is for the holding the smaller size. Okay. And the scissors, various kind of scissors, depending upon which structure, and we have to cut, and whether it is superficial or deep, or we have the suture cutting or the tissue cutting. It is a various type. The both straight scissor, curved scissor, both the end. It is a one end sharp, one end pointed, one end blunt. Both the end pointed, the curved one, blunt scissor, and the both the end blunt. The Mayo special kind of scissor, Mayo dissecting, and the Metzenbaum scissors. Okay. Next is bandage scissor. There is a special type of scissor which is used to remove the bandages. The special thing to be noticed is the skip. Okay. On our next class, we'll discuss various retracting and exposing instruments. So we will be benefited if you go through those things before coming to the class. If you go through these instruments, then it will be easier for you to understand. If any query, you can ask me. You can give me messages. That can we? I think we conclude here today. Bye-bye.